Okay, now we're going to do some additional muscles of the lower extremity. Again, these are not the common ones, but these are ones that you can do and when indicated a little bit more than rare muscles. So we're going to do the adductor, which is there are a few L4 muscles. So the adductor is one of them. So we're going to do the adductor. We're going to do the extensor hallucis longus muscle, which is a very good L5 muscle. Then I'm going to ask the patient to go onto his side, and we'll do the peroneus longus muscle, which is another good S1, L5, S1 muscle, and then the gluteus medius, which is another good proximal L5 muscle that has no peroneal or tibial innervation, so no sciatic nerve. So that is another good muscle to check for radiculopathy. So the adductor is a big muscle, but it's deep, and it's also, like the gastroc, doesn't have too many motor units in it. So it's going to be a little bit difficult to get a good activation and good recruitment of the adductor muscles. The adductor is going to be in between the quadriceps and the hamstrings. So you're going to kind of sandwich the needle in between those two muscles. So you can ask the patient to do a quad set, so make your knee straight. Make your knee straight. Good. So there's the quadriceps. I can feel the end of the quadriceps here. And now push your whole leg down on the table. So push your leg, then I can feel the hamstrings muscle down there. So there's the hamstrings, there's the quadricep. The adductors are going to be stuck in between. So the adductors are going to be right in between those two. So that's where I'm going to insert my needle. Again, I switched to a longer needle again, the 2-inch needle. Some larger folks, you may need to use a 3-inch needle to get to the adductors because these are very deep. So again, we'll do the same process as before. So you can relax. And the action for the adductors is going to be trying to squeeze the legs together. So when I ask the person to squeeze his legs together, that's the motion I'm going to try to elicit with that. Okay, so again, I'm going to come in straight in towards the muscle. So there's the muscle, nice and relaxed. Here we go. And there we go. Now we're in the muscle. Turn the machine on. Turn the sound up. Very good. Okay, now I'm going to insert it. Okay, now ask the person to do the motion. So cross your legs, put your legs across. Okay, so we're not there yet. Go a little stronger. Okay, so we're not close to the muscle yet. Okay, relax. So I'm going to try a different angle. Push your leg across. There we go. Now we're in. So now we're in the muscle and relax. Good. So now we're in the muscle. So sometimes just a little redirection and you can find where the location of the muscle is. So now we're in the muscle. Doing okay? Feel okay? Mm-hmm. All right. Okay. So now we'll do the same quadrants, same technique. So we're going to go 1 depth, 2 depths, 3 depths. There's one quadrant. Extract out. 1, 2, 3, after each depth, I wait a second, see if there's any spontaneous potentials. Extract out. 1, 2, 3. Very good. Extract, no spontaneous potentials. Extract out, redirect. 1, 2, 3. So those were the 3 depths, 4 quadrants. Everything was nice and quiet. I can press stop the live screen. Now I can go to store that live buffer. So now it's stored. Go back to live again. Now I'll go down to up to 200 on my gain. Okay, so try to squeeze your leg together. Good. And a little too strong. Good, just like that. Now we're getting some nice motor units there. So again, this one, because there's so few motor units, it's going to be a little bit challenging to get 12 to 20. So get as much as you can, as best as you can do. I can insert a little deeper. Again, I'm seeing those nice normal motor units. Normal amplitude, normal shape, normal duration. I can go a little deeper. And I'm losing them there. There we go. There's some nice motor units there. Again, normal shape, normal amplitude, normal duration. I insert the needle a little deeper. There we go. Normal shape, normal amplitude, normal duration. So I'm assessing it as I go along. So let's pretend that was 12. So let's stop that. Ask the patient to relax. I stop the monitor. I hit store live buffer. That buffer is stored. I go back to live. Now I'll go up to 500. Now this is going to be tricky to get that full recruitment, but we'll see what we can do. So very gently, bring your leg across, push across. Good. Good. And now go a little stronger. We're seeing we're activating more motor units. Good. Now go a little stronger. And a little more. And a little more. And a little more. And that's probably as best as we're going to get. So I'm relaxed. So again, these very large, very big muscles in the lower extremities, it's going to be a little bit difficult to get a full interference pattern of blocking out the baseline. So these are relatively normal. So again, this one is, you got to use your discretion to find out to make sure that they're close enough. So that was the adductor. So now we can go and we'll do a different muscle. We'll do the extensor hallucis longus. So the extensor hallucis longus is, again, another very good muscle to check for L5 radiculopathies. So it's very often involved in L5 radiculopathies. Now this muscle is very different. Turn your leg this way a little bit. There we go, perfect. This muscle is very different from the adductors in that this one is very long and very thin. So this one, you don't have to worry about, once you find the muscle, you don't have to worry about getting good recruitment, but the trick is to find the muscle because it's very long and very thin. So it's usually a little bit lateral to the tibialis anterior tendon. So if you ask the patient to bend their ankle up, there's tibialis anterior tendon. The EHL is just a little bit lateral to that. So now if I ask the person to only bring their big toe back, so bring your big toe back, and I can feel the muscle kind of popping up a little bit under here. So I'm relaxed and bring up again. And there's the muscle tendon right there underneath my finger. So this one is, again, it's a little bit long and thin. So you're going to have to, when you insert the needle, so there's the muscle there. When you insert the needle, again, you're going to have to insert it in the direction of the muscle. So you're going to not go straight through it into the shaft of the bone. You're going to insert it at an angle going upwards, going proximally to get into the muscle. So it's going to be into the muscle that way. So this one is a little bit of a kind of trial and error, trying to find the muscle, but if you can palpate it first, it's about a couple of finger breadths above from the malleolus, above from the medial malleolus, just lateral to the anterior tibialis tendon is where you can find that muscle. Okay, so now I'm ready to go. So I take the needle out of the sheath, and again I'm going to insert it not going downwards because that's going to hit the shaft of the bone. I'm going to go upwards towards the proximally. So nice and relaxed, here we go. Feel okay? All right, turn the machine on. And now we need to make sure we're in the muscle first. So very gently bring your toe back. Nope, not yet, we're not in yet. So I'm gonna insert a little more, there we go. Now we're probably in it, but let's make sure, bring your big toe back. Nope, not yet. So I'm gonna go insert a little bit. Okay, bring your big toe back. Nope, not yet. Let's change my angle a little bit. So I'm going to extract it out. Nope. Let's go the other way. So it's again, it's a little bit of a trial and error. Okay, bring your big toe up. Nope, still too a little distal, so I'll go a little bit deeper. Bring your big toe up. Almost there. Relax. Let's go a different angle, see if we can get it. Bring the big toe up. Oh, still not there. So let's actually take the needle out. And I'm going to insert it a little bit more medial. So I'm going to come a little bit more medial to it. Okay, nice and relaxed. Here we go. There we go. Okay, now bring your toe up. Okay, not yet. Doing okay? Okay, there's bone, so I'm going to come out. Oh, don't have it yet. Oops. Okay, so the needle touched me, so I'm going to discard that needle. Okay, so give give me a second. I'm going to just replace this needle. Sometimes it's a little bit challenging to get this one. So just toss that needle to the side. A little pressure there. Place the needle back in the holster. All right, let's see. Bring your big toe up. Okay, there, I feel it there, so I'm going to go a little bit distal, see if I can find it there. So bring your toe up again. Good, there it is. So I'm going to insert it right here. So I'm going to come a little bit distal to it. Insert it in the same direction, same location again. Okay, nice and relaxed. There we go. Okay, bring your toe up. Okay, relax. Bring the toe up. Okay, relax. Your EHL is hiding on me. Okay, I think we got it now. Bring the toe up. There we go. Now we're in. Okay, very good. And relax. All right, so sometimes a little trial and error, but now we found the muscle. Okay, so now we found the muscle, so now we can do our 3 depths and our 4 quadrants. Okay, so 1, 2, 3, relax, good. Extract out. Very small angle change. 1, relax, good. 2, relax. 3, good. Extract out. Redirect. Lost it. There we go. Back in. Relax. 2. Relax. Good. 3. Good. That's 3 quadrants, 4 depths. Store that buffer. Stop it. And store that buffer file. Good. Now we'll go back to live again. Okay, now we're in live. So now bring your big toe back. Good. Now we're getting some nice motor units there. There we go. Again, normal amplitude, normal shape, normal duration. Those are all normal. You can go a little tiny bit deeper. Went a little deeper. Got some normal motor units there. Doing okay? Good. Go a little more. Got some nice normal motor units there. Again, normal shape, normal amplitude, normal duration. Good. Okay. So now we can store that. Stop that buffer and store it. Okay, good. Okay, now we'll go back to live again. Make it to 500. So very gently, try to bring your big toe back. Good. And a little stronger. A little more. A little more. A little more. A little more, a little more. Push, push, push. And some decent recruitment and decent interference pattern on that muscle there. And relax. Good. So I'll take the needle out. Give the patient a chance to relax a little bit, shake it out. And that one a little tricky, but sometimes it's a little trial and error. Sometimes you just got to palpate and find the muscle, and you use your clues as far as when you're hearing muscle. If you don't hear the muscle, don't hear nice, sharp, crisp, then you're not in the muscle. So sometimes you have to take the needle out and redirect it, go a little bit more distal, a little bit more proximal to find the belly of the muscle. So that is the extensor hallucis longus. Okay, so next we'll do the peroneus longus. And for this muscle, again, you can do this muscle in supine, but I like to do it in side lying only because now the gastroc is down and resting out of the way. The peroneus longus runs from the fibular head going all the way down on the lateral border of the leg. So when the patient is side lying, The gastroc, which is right next to it, is going to get pushed out of the, kind of relaxed out of the way, so it flops out of the way. The motion for the peroneus longus is going to be eversion. So we're going to ask the person to turn their foot out to the side. So very gently turn the foot out to the side, and you can palpate that muscle coming up right there, and relax, and push out to the side again, and relax. So you feel for that muscle, you feel a person pushing out to the side, and again, you're going to angle the muscle, you're going to insert the needle in the direction of the muscle. So you're angling it down in that way. So this is going to be the peroneus longus muscle. So here we are. Okay, take the needle. I'm down at 100 on my gain. Okay, so we have the needle. I'm going to insert it here, nice and relaxed. Here we go. Feel okay? Yep. Okay, turn the machine back on. Turn it on. If you wanted to check, turn the foot out to the side, and we're in. So again, that's how you can check that you're in the muscle, by having the person do the motion and just hearing for some motor units. So we're in the muscle, so now we'll do our same technique. 1 depth, 2 depths, relax. So there was some end plate noise. So you can hear that kind of, those are end plate spikes. And that's probably a little bit uncomfortable for you, so I'm just going to move it now. But end plate spikes, again, are a normal phenomenon that you'll encounter when you're next to that muscle fiber, when you're next to that neuromuscular junction. So I just moved it out of the way, so I don't need to see end plate spikes, they're just there. So there's our second depth, and now our third depth. So that's 3 depths. I can extract the needle out, redirect it. 1, 2, 3. Extract the needle out. 1, 2. There's some end plate sound. So it sounds like a seashell type sound. So I'm close to that neuromuscular junction again. So that's end plate sound. So again, it's probably a little bit uncomfortable for the patient. So I'm just going to move it out of the way. So again, if you hear that end plate, that seashell type of sound, or you see that very sharp negative deflection of a waveform that's very fast and very irregular, those are end plate spikes. Those are a normal phenomenon when the needle tip gets too close to the neuromuscular junction. So there's my third depth. So there's my 3 quadrants, my 4 depths. I stop it. Now I store live buffer. I'm on peroneus longus. I store live buffer, so it's stored. Go back to live. Go to 200. Okay, very gently, push your foot out to the side. Good, perfect motor unit there. Nice, sharp, crisp popping sound. That's 1 motor unit. I can push the needle down a little more. There's a second motor unit. Again, normal shape, normal amplitude, normal duration. Move the needle down a little bit. There's another one. Nice normal amplitude, normal shape, normal duration, all very good. Okay, I'll extract it out, go 1 more direction. Again, there's normal motor units, normal shape, normal amplitude, normal duration, all very good. Okay, relax. So let's pretend that that was 12. I'll stop that. I'll store that live buffer. So the buffer is stored. Now I can go back to live again. Now I'll go up to 500. So we'll see if we can get good recruitment. So very gently, push your foot out to the side. Good. There's some nice normal motor units. Now push a little stronger. I'm looking to see the motor units get bigger as I go for more recruitment. I'm watching them grow in size and not being repeated too often on the same screen. Go a little stronger. Good. And go a little more. Again, this one may be a little bit hard to get good recruitment. We'll do the best we can. Go a little stronger. And go a little more. There we go. And go a little more. And good. That baseline is pretty much not straight, so that's very good. And relax. Good. Turn the machine off, stop the buffer, and store it. So there is our, again, these lower extremity muscles, it'll be quite a little bit difficult to get full obliteration of the baseline and a complete interference pattern. But again, it's normal enough because we're looking to see how well the waveforms, how many that can be, motor units can be activated. So that was the peroneus longus. So now we're just going to switch a little bit and we're going to do the gluteus medius. So we're going to move, I'm going to come around here. For gluteus medius, it's not as posterior, not as down as you may think. The gluteus medius is right underneath the iliac crest. So there's the iliac crest right in here, and gluteus medius is just to the side. So the gluteus medius is not as posterior and not as distal as you may think. The gluteus medius is our prime hip abductor. So the action for this muscle, I'm going to ask the person to bring their leg away from their other leg. So they're going to do like a clamshell type exercise. So you're going to do that motion there, and I can feel underneath my thumb, I can feel that muscle bulk popping up right there. So that's where I'm going to insert the needle, right on that gluteus medius. So I can move my electrodes. Let's switch my hands. I'll move my electrodes here. And I'm going to just take a little alcohol and wipe down the area. Okay. All right, so again, the action for the gluteus medius is going to be pushing the leg out to the side. So bring your leg up away from the other one, so push out. And I can feel the muscle underneath my thumb, so there's where the muscle is going to be, so relax. All right, so I take the needle again, and this one is going to insert straight through. So I'm going to insert it down. Okay, nice, relaxed, here we go. Feel okay? All right, so I'm getting a little bit of feedback, so I'll move this a little closer. There we go. Okay, so I heard noise. Let's see if I'm in muscle. Bring the leg apart. Good. Now I got the right motion. So I'm in muscle. You can relax. I got the motion I wanted, so I'm in the correct muscle. All right. So now I do my same. That's 1 depth, 2 depths, 3 depths, and again I'm almost at the tip of the needle. And this is a 2-inch. That's why 1.5 inch is not going to cut it a lot of times. So I'm going to take the needle out, go to a different quadrant. 1, okay, relax, relax. Sometimes a little tender. 2, 3, good. Extract out, redirect. 1, 2, 3. Extract out, redirect. 1, 2, 3. So there's my 3 depths, my 4 quadrants. I stop it. I store that live buffer for glute medius. There we go. Okay, go back to live again. Go down to 200, up to 200 on my gain. Okay, very gently, bring your leg apart. There we go. So I'm getting a little bit of polyphasic motor units. There we go. Now I just move the knee a little bit, look a little polyphasic, and relax a little bit, just go a tiny bit. Very good. So now we see those motor units, normal amplitude, normal shape, normal duration. Going to go a little bit superficial with the needle, and we started losing it a little bit. You hear how dull they sound. So I'm going to go back to deeper again, now they're nice and crisp again. So I'm getting some nice crisp motor units, so that's what we want to see. I'll go down a little bit. There we go. There's a couple different more. Good. Okay, hold that contraction. I'm just going to redirect it. See, I'm in subcutaneous. I can redirect. Now I'm back in muscle. There's some polyphasic ones there. He's going a little bit too hard. Just relax a little bit. There we go. Nice normal motor units. Nice normal ones again. Okay, I'm going to redirect it again. Good, that's perfect one there. Nice and normal. Normal shape, normal amplitude, normal duration. Good, very good. Okay, relax. Stop the buffer. Store it. Now I'll go back to live again. Go up to 500. Now again, this one will probably be a little bit tricky to get the full interference pattern, so very gently push up. Good, that's nice. Okay, nice recruitment there. Now I'll go a tiny bit stronger. There, they're getting more frequent and they're getting bigger. That's what we expect to see. Go a little bit stronger. Go a little more. And a little more. And a little more, a little more. Push, push, push. And relax. Good. And relax. Good. So stop the buffer, and now I store it. And there are my 3 buffers. Again, with the lower extremity muscles, it's a little bit trickier to get full interference pattern just because the muscles are so big. But that's, you know, enough to fill the baseline, so that's normal enough. All right, so those are the additional muscles of the lower extremity. Thank you.